To make your travel easier, we can arrange your airport transfer and hotel accommodation on your arrival date. On your first day of your treatment, you will have consultation with the doctor, and together with your partner, you will do initial tests which are required for IVF treatment.
I'd like to mention what happens after an infertile couple applies to an IVF center. There are some tests to be done prior to starting any treatment. The first test is the sperm analysis, which shows the sperm count, motility, and morphology of the sperm. If sperm analysis shows an abnormal sperm count and abnormal sperm values, men can be referred to an urologist.
İnfertil çiftin değerlendirilmesinde kadının yumurtlama fonksiyonları, anatomik yapısının değerlendirilmesi kadar erkeğin de değerlendirilmesi çok önemli. Aslında çok basit bir testle yapılıyor bu. Spermogram dediğimiz sperm analiziyle yapılıyor. Basit bir sperm analizinde çiftin tüp bebekteki şansını açıkçası kestirebiliyoruz. Spermin çok az olduğu, yapısının çok kötü olduğu durumlarda mikroenjeksiyon yani X uygulaması çok elzem bir uygulama. Normal şartlarda hiç döllemeyecek spermler tek bir spermin yumurtaya verilmesi sayesinde fertilizasyon sağlayabiliyor. Dolayısıyla gebelik oluşturulabilecek bir embryo gelişmesine neden olabiliyor.
After the evaluation of men, it comes to women. The first test is vaginal sonogram, which reveals uterus and both ovaries. We can get some information by just checking ovaries. We count antral follicles. The second test would be hormonal analysis. We check thyroid hormones, prolactin hormone, and we do some analysis to evaluate in details the ovarian reserve. There are mainly two tests to be done to check ovarian reserve. There are FSH level and the AMH level, anti-Mullerian hormone level. After having all these tests done, we plan the treatment. Usually treatment starts on cycle day 2 or 3 because this is the first phase of the ovulation induction, first phase of the menstrual cycle. When we stimulate ovaries in the first phase, follicles respond to treatment and they start getting enlarged, getting bigger. Follicle tracking gives us invaluable information on the follicular response, on ovarian response, and we alter the dose of ovulation induction agents by just having this information by follicle tracking. Patients need to be monitored after starting using medication to induce ovulation. The main purpose is to get as many follicles as possible, but preventing ovarian stimulation. And meanwhile, I would like to get a good number of follicles to achieve best pregnancy rates. By using vaginal sonogram, follicular diameter as well as the number of follicles are measured. The aim is to get follicles reaching 17-18 millimeters in diameter. Once we get this diameter, the last injection, the last maturation injection is given to collect mature eggs out of follicle aspiration. 34 to 36 hours after the last injection, follicle aspiration or oocyte collection is programmed, is scheduled, and it's done under mild sedation. I would like to mention some important steps of IVF procedure today. It's a very common procedure worldwide. Almost 5 million babies have been born through this technique, and there are many new advances, new developments carried out in the recent years. IVF procedure starts with the evaluation of the couple. Sperm analysis to get some information about the uterine cavity, tubes, as well as some hormonal levels in both men and women. After the evaluation procedure, then starts ovulation induction. Ovulation induction means the stimulation of the follicles to get as many as possible. Ovulation induction takes almost 10 to 14 days to get follicles reaching 17-18 millimeters in diameter. Once they reach this diameter, we give triggering injection, namely Ovitrel, that stimulates the maturation of eggs. Ovitrel injection is very important because 34 to 36 hours after Ovitrel injection, egg collection is performed. You should pay attention to taking this injection carefully on time in a proper way. Otherwise, we may end up having no oocyte or a very bad quality oocyte due to wrong injection of this medication. Egg collection is performed, as I told you before, 35 hours after Ovitrel injection. We do egg collection under a little sedation, so we put you on sleep. It's a painless procedure, so don't be afraid of having egg collection. After follicular aspiration, we send the follicular fluid samples to the lab as embryologist starts searching for the presence of egg. Then eggs are stripped from the surrounding cells called granulosa cells. After identifying of the eggs, we keep them in the incubator for 2 to 3 hours. Embryologist injects one sperm, a single sperm, into eggs to get fertilization. In Turkey, almost all cases are performed through intracytoplasmic sperm injection in order to decrease fertilization failure. One day after the injection of sperm inside the egg, embryologist checks for the fertilization. 2 days later, embryos become 4-cell. 3 days later, embryos become 8-cell. We usually transfer embryos 3 days after egg collection at 8-cell stage, or 5 days after egg collection at blastocyst stage. If we have more than 3 embryos on day 3, we try to go up to day 5, so-called blastocyst stage, to select best available embryos. Embryos reach to blastocyst stage 5 days after fertilization. Blastocyst stage contains almost 200 cells with the cavity and have a better potential of implantation. Embryo transfer is a very simple procedure. It's like an examination, like a gynecologic examination, painless, so you don't need to be put on sleep during embryo transfer. It takes 5 minutes, so it's done by using small tiny catheter to place the embryos into the uterine cavity. How many embryos are transferred? This is the most common question to be asked by our patients. We usually transfer 1 embryo in women below 35 and 2 embryos above 35. By the time, we try to transfer only 1 embryo in all couples to prevent multiple pregnancies. Because multiple pregnancy is accepted as a complication of an IVF cycle, so we tend to transfer as few embryos as possible. So single embryo transfer is the gold standard. Our aim is to get a single healthy baby. After embryo transfer, you are instructed to use some medications such as progesterone to improve potential of endometrium, to prepare endometrium better. So you are supposed to use this medication for at least 12 days until the day of pregnancy test. And pregnancy test is usually done by getting your blood and checking beta HCG level in your blood sample rather than urine analysis, because blood analysis is much more sensitive than urine analysis to diagnose pregnancy. Once we get the positive pregnancy test, you are to keep getting these medications for up to 10 weeks to support the pregnancy, and then at the 10th week you don't need to keep taking this medication longer. I also advise you not to think about the result of IVF, because psychologically you should be focused on the success rate. Enjoy your life. Please do not hesitate to contact us for an IVF cycle. It's painless and seems very effective and safe procedure. We'll be supporting you as much as we can. We are looking forward to seeing you in Turkey. Good luck.